At THV11, it is our mission to continue to educate you about the opioid crisis and work to eliminate the stigma of addiction. Using drugs or drinking alcohol while pregnant can be dangerous for both mom and baby. But for some women, pregnancy isn't enough to quit. But there is hope, thanks to a program designed to help pregnant women overcome their addiction.
I started using probably when I was about 18, 19, after high school.
It started as peer pressure for now 35-year-old Grayson Moore. At 20 years old, her life changed.
I found out I was pregnant and I continued using.
Moore was addicted to meth and drank during her pregnancy. Her son, now 14, was born healthy, but she continued to use and eventually handed custody over to her parents.
You know, for most people who aren't using, it was, you know, I'm a mom, so I'm going to be a mom, you know. But for me, it was a decision. Like, I didn't know what I wanted to do, and that's really sad.
Over the next several years, Moore had 2 more children. She was arrested and in and out of rehab as she struggled to overcome her addiction.
I willingly gave all my kids to my parents, you know.
That must have been very hard.
It was very hard, but I also knew that I was going to be stuck in it.
There aren't many places in the state that will treat a pregnant woman with a substance abuse disorder, but a program at UAMS in Little Rock offers just that.
To date, over the past 2.5 years, we've treated almost 200 women, 6 years in the Department of Psychiatry.
Psychiatry specialist Dr. Jessica Coker runs the Women's Mental Health Program at UAMS, the only outpatient clinic of its kind in the state.
In order to qualify, you just have to be pregnant or within 3 months postpartum, and you have to be abusing substances.
The women take opioids to treat their addiction, participate in therapy, attend parenting classes, and undergo mandatory drug screenings.
I find it to just be really a gratifying experience that I get to help these women who are coming forward and saying, I have a problem and I want the help because I do want better for my children than what I had.
He's kicking me.
And that is exactly what Moore is focusing on today. 8 months pregnant and nearly a year and a half in recovery. She's working to create a better life for her and her family.
I don't look at my past as, you know, a mess up. I look at it as a learning experience, you know. And I hope that my kids can look at it and just walk down a different path.
This program at UAMS is the university is working with obstetricians to refer women to the program, and Dr. Coker says it really starts with those OBs asking questions of their patients, asking if they're using, and then being able to direct them to the proper programs like this, give them resources that are available, because there are places available. I think women who are pregnant are just fearful of seeking that help for fear that their child will be taken away from them.
For sure. I mean, it's a very scary thing to admit, but when you're able to admit that you're struggling, people are there, just like this program, to help you. And how brave of that woman that you interviewed to be willing to share a very dark part of her life in order to help others. And I hope that other women will hear that, hear her vulnerability in that story, so that they can go get the help they need to protect them and their kids.
I know that wasn't easy for her to share, but in order to help other women, she's doing that, and she's sharing her past. Again, that program, we have more information on it on THV11.com. I can't urge you enough. If you are using right now and you are pregnant, go to this program. They will help you. They will provide the resources that you need.